Laser treatments work. We've all seen the great results, but when is the best time to start those treatments? When the skin is already damaged or before you see that damage? What do you think?
Well, obviously, it's better to start before you look like a total disaster, right? It's easy to fix someone along the way than if they're really like just almost dead. But patients with significant photo damage need more aggressive treatments. And if you have a lot of lines, if your mouth looks like the Grand Canyon of lines, then we have aggressive lasers that have a lot of downtime. If you have minor little things, we have things that can improve your skin quality with not a lot of downtime. So the worse you are, the worse you're going to have it in your recovery period.
The way I talk to my patients is more about you get what you pay for, and not from a cost perspective, but more from a downtime perspective. And the earlier you start, to Jason's point, the less aggressive we need to be, therefore the less downtime. The longer you wait, the more aggressive we need to be to get the results, and therefore the longer the downtime.
I mean, Duncan, what do you think? Is it harder to treat someone with a whole face full of acne scars, or maybe get on top of their acne when they're young and not have those scars?
Definitely,
I mean,
be proactive. And I think that's the trend in our industry in general, is that people, because of social media, people are starting to come in earlier, but that actually makes our job easier. Now, we've talked before about there's a lot of surgical and non-surgical interventions. Some surgical interventions are being deemed obsolete at this point because we're starting non-surgical interventions earlier, and these people are ending up not needing certain things, and laser's a big part of that.
My generation was out there with these tan accelerators and all of these things, and iodine. I mean, they didn't have sun block then. They had suntan lotion to enhance your tan. Nowadays, you have kids, right? I'm sure you don't let them out of the house without a full face of sunblock. So I think the future generations are doing a better job of taking care of themselves than we did.
And it also depends what the patient wants. I mean, right? We have to ask the patient, what are you after? And is it the discoloration? Is it those fine lines, the smoker lines?
Well, they all
or the
want to
straw
look
lines?
20.
Yeah,
right? Everyone wants to look 20.
But they're not willing to take the downtime that's associated with the more powerful lasers. So to me, it's a balance of what are they looking for and what are they willing to do from a downtime perspective.
And smoking kills them. Like if you smoke and go in the sun and go through menopause, that's like the holy terrible trinity of things that you can do to yourself. So menopause, you have no choice, but maybe you take some hormones. But smoking really kills your skin. So you see all these smokers with terrible lines and terrible things. I mean, it's a harder job to correct that than the 25-year-old with maybe a little bit of spots on their face.
And the other thing with lasers is there's a lot of lasers that are maintenance lasers that don't necessarily turn the clock back, but slow the clock down. And then there's the bigger lasers, which actually try to turn the clock back. So it's sort of a combination of maybe some maintenance lasers every 6 months, maybe in the fall and in the spring, and then, once a year, one of the more aggressive lasers, and then maybe once in your lifetime, the big aggressive laser if you need it.
And to be purely technical, they're not all lasers. These are devices you plug in a wall to help you. And they go from radio frequency to ultrasound to lasers to microwave energy. We have a lot of different types of devices that help to rejuvenate patients. So, go to an office that has multiple types, as does your med spa and my med spa. We have lots of options available to the patients, and we'll tailor it to your specific needs.
Yeah, and that's the problem with practices who don't have access to this technology, which is a true luxury. I mean, we are very fortunate, but they have one machine that does one thing, and they say, well, that's the answer for you. And
that's the answer for everybody.
Yeah,
it may not be the case.
Yeah.
It's not one size fits all.
That is correct.
There's something for everybody. Be sure to check out the Plastic Surgery Channel on YouTube and at theplasticsurgerychannel.com.